Christopher Field was born in January of 2000. Ever since then, he's lived a seemingly wonderful life. From playing baseball to acting in Campo Verde's own production of The Green Bird, and even winning first in the Gilbert Roadrunner Special Olympics. You could say he's done a lot, but perhaps what he is mainly recognized for is being an outstanding performer within the Campo Verde band program, both on the football field and on stage.
However, what most people don't know about him is that he was born prematurely. He is also known as a preemie.
So, typically, kids are born between 36 and 40 weeks. 38 and 40 is ideal. 36 is when you're considered a preemie. 36 and below. At 26 and below is a micropreemie. So that's actually the technical term for them, is a micropreemie.
When a child is born so early, they may not be done developing various major organs, such as the brain, liver, and lungs. This can affect future growth and often lead to higher risks of disability.
1 out of 10 babies are born prematurely every year. As of a couple years ago, premature birth has accounted for 17% of infant death.
Okay, hi, I'm Dr. James Sozo-Brado. I'm the medical director for the Neonatal Intensive Care Unit at Chandler Regional Medical Center. I also serve as the past chief of pediatrics for this hospital. I cover Chandler Regional and Mercy Gilbert Medical Center. As far as the baby is concerned, sometimes it could be as a result of the fact that the baby may have some compromised circulation in utero as a result of movement, and by that I mean some presence of their umbilical cord being wrapped into a body part like the neck, the arm, decreasing blood flow to the baby. Most commonly, when premature babies are born, just by virtue of the fact that their organ systems are also immature, primarily their lungs, these babies might require some help with their breathing. The help may be in the form of just a simple nasal cannula that provides pressure into the lungs to help open up their lungs. Or, depending on the severity of their condition, these babies might require intubation followed by mechanical ventilation.
Intubation is a process in which an endotracheal tube is inserted through the mouth into the airway stream. This tube is then connected to a ventilator, which is a machine that delivers oxygen into the patient's lungs.
My water broke in the middle of the night on January 5th, and he was born January 23rd. So I made it for 18 days with no water for him. He was 1 pound 12, and he was 13 inches long, which is the same as this dog. This was the dog that was in the unit with him the whole time. This was his first outfit. And these were the diapers. So just, it kind of gives you perspective, because you think you don't know how big that is. And so this diaper on that dog, this outfit. they told us to go out and buy doll clothes. Now remember, this is 17 years ago. They don't do that anymore. Now they actually make preemie clothing. So he got the medicine. Our doctor appeared out of nowhere. We considered it a miracle. Our doctor just happened to be on call that night. And he came in and they were telling us he was going to go into a blind study, which meant maybe or maybe not he would get the medicine to keep him alive. Our doctor said no, he's getting the medicine, and which was magnesium. And that's what kept him going for the 18 days. And then when he was born suddenly. Just everybody thought I had the flu because I'd never had a child before, so I didn't know that all those feelings. So he was born on the 5th floor, and the children's unit was on the 3rd floor. It was quite exciting. He was supposed to be born in May. So he came January 23rd, and he was put into the NICU, which is the Neonatal Intensive Care Unit at Phoenix Children's Hospital, 3rd floor, for 4 months. And he went home on his original due date, thank God. He came home with a tracheotomy, that's breathing through a tube in your neck, an apnea machine, and a feeding tube. He was on a lot of different medicines. I have a list. We have an Excel spreadsheet that we had to create to know what to give him when. He had to be, this medicine every 4 hours, this one every 6 hours, this one every whatever. They wanted him to, actually didn't want him to go home. They wanted him to go to a different kind of hospital, kind of like a step-down unit. And we said, nope, test us, we know this, we can do this. And we tested out and we got him to get to come home. And like I said, he came home in May, right when he was supposed to be born. He was always known as failure to thrive, which means that you never just quite, you're always struggling. You're always behind the curve. He was always on the 5% on the chart, and he had a feeding tube till he was 9, so he didn't eat until he was 9. We tried, he kept trying and trying. The problem with preemies is, and this is a typical problem, they get everything to keep them alive through their mouth. And so they get very sensitive to the mouth, which is part of the reason we think why he can't speak very well, because he's very sensitive to his whole face, and which is why it's a miracle that he's playing the euphonium, because he technically shouldn't be able to play the euphonium, but he wants to so badly that he's trying his best, but he has limitations. But hopefully he'll work hard and get past those limitations, and then hopefully it'll help him speak better.
So is this method like your only way of communication?
Yes.
I communicate with my words and using my device and finger spelling. The device slows me down and people don't wait long enough for my answer. Finger spelling works if you know sign language. It takes me a little time to answer sometimes, which is hard on my friends. I am taking speech lessons to talk better. I want to talk and I have to work to stay focused.
The biggest thing right now is his trach, his trachea is, I didn't know this could happen, but you can outgrow your trachea. So because his trachea, yours and mine are a straight tube going down. His is like that because of all the work they did. When they fixed his, they had to actually take that part out. So they took out 1.5 inches of his trachea and sewed it back together. And he had to sit with his head sewn down to his chest for 10 days. Imagine doing that to a 3-year-old. So the problem that has caused is now he has this hourglass. So the only time it becomes a problem is when he gets, we all have allergies of some sort, so you get drainage, and it irritates the mucus, irritates everything, and so then it gets to, because now it's getting irritated, and so the trachea is closing and closing.
neonatology is one of the youngest medical fields in pediatrics. There are evolving management for our subgroup of patients. Definitely look forward to some changes down the road the more we understand about various disease pathologies.
Despite everything he has gone through, Chris has never given up. His difficulties and small beginnings haven't stopped him from making the most out of his life.
He doesn't think there's anything different about him. And so when we say, well, you just learned a little different, he's like, okay. He's happy with that, he doesn't. So challenges are a good way because that's what it is. It's just a different way of doing things. And so that can be a challenge in life because everybody else is doing it one way and you have to do it slightly different, or you have to just work a little harder at it, or break it down. A lot of what we do with him is we break it down into smaller steps. First you do this, then you do this, then you do this, and then you do that, and then you're done. Let's do it again. Do this, then this, then this, then this, and now you're done. Do it again. And you just do it over and over and over, and pretty soon, okay. Where that is, that's how he was taught to put on clothes. Okay? Where you and I, boom, we just learned to, we just put the shirt over our heads and went with it. No, first you have to put the tag in the back. And then, there's more things. It's called executive function. And it's, you take for all the different things that you do, how you work through a problem is called executive function. That's all the things you do.
Because I was premature and had many medical complications, my overall development has been delayed and my skills are sometimes not very coordinated. Some people have underestimated me all my life. When I left the neonatal intensive care unit, the doctor said I was deaf and blind. Obviously not. When I was young, some thought I would never be able to walk. Wouldn't they be surprised to see me playing in band? Hard work has not stopped me from overcoming challenges, and I won't let anything hold me back.
Is that all life is important. And Christopher's favorite book was Horton Hears a Who. A person's a person, no matter how small.